Most people talking about methylene blue online are missing the most important point. This is not a vitamin. It is not a natural nutrient your body runs out of, and it can act more like a drug than a supplement. That does not mean it is useless. It means you need to understand what it is before you put a blue dropper bottle in your mouth. In this video, you will learn what methylene blue actually does, why people connect it with energy, focus, and mitochondria, where the evidence is promising, where it is still very early, and the safety issues that matter most. And here is one useful change you can make today. Before taking any methylene blue product, make a simple medication list and check it with a qualified clinician or pharmacist, especially if you take antidepressants, migraine medicines, opioids, cough medicines, or anything that affects serotonin. Do not change supplements or medications without talking with a qualified clinician first. Methylene blue is a synthetic blue dye that has been used in medicine for more than a century. In hospitals, injectable methylene blue is approved for a specific condition called acquired methemoglobinemia, where red blood cells have trouble carrying oxygen properly. The official US prescribing information describes it as an oxidation reduction agent, which simply means it can help move electrons around in chemical reactions. A simple way to picture it is this. Inside your cells, your mitochondria are like tiny power plants. They move electrons down a chain to help make ATP, which is the main energy currency your cells use. Methylene blue is unusual because at low concentrations in lab and early human research, it may act a bit like a temporary backup wire in that energy system. It can accept and donate electrons, which is why researchers are interested in it for mitochondrial function. But that does not mean more is better. With methylene blue, dose matters a lot. The same compound that can help move electrons in one setting can create stress in another setting. That is why casual just try a few drops advice is risky. Your body does not make methylene blue naturally. There is no methylene blue deficiency. There are no methylene blue foods. You cannot eat blueberries, spirulina, or blue corn and get methylene blue. Those foods contain natural pigments and plant compounds, but they are not the same thing. What your body does make naturally is energy through mitochondria, and that system can be affected by sleep, movement, nutrition, inflammation, blood sugar, oxygen delivery, thyroid function, medications, alcohol, and chronic stress.
So when someone says methylene blue supports energy, the better question is, what energy problem are we actually trying to solve? Mechanism number one is mitochondrial electron flow. Methylene blue may help shuttle electrons in the mitochondrial energy chain under certain conditions. That is the main reason it gets discussed for brain energy and cellular function. Mechanism number two is redox balance. Redox means reduction and oxidation, the constant passing of electrons that keeps your cells working. Methylene blue can participate in this process, but again, context matters. At the wrong dose, in the wrong person, or with the wrong medication, that same activity can become a problem. Mechanism number three is its effect on methemoglobin. Methemoglobin is a form of hemoglobin that cannot carry oxygen well. In a medical setting, methylene blue can help convert methemoglobin back toward normal hemoglobin, which is why it is used for acquired methemoglobinemia. The labeled hospital dose is typically 1 milligram per kilogram by IV over 5 to 30 minutes, with careful monitoring, not casual home use.
There are no best food sources of methylene blue. Food is enough when your goal is general mitochondrial support, because food, sleep, and exercise support the systems people are trying to influence. Food is not enough if you have a true medical emergency, like methemoglobinemia, because that is not a nutrition problem. That needs medical care. For daily habits, start with the basics that actually support mitochondria. Aim for a protein source at each meal, roughly 25 to 40 grams for many adults, depending on body size and activity. Eat at least 400 to 800 grams, or about 1 to 2 pounds, of vegetables and fruit across the day if you tolerate them. Walk 20 to 30 minutes most days. Do 2 strength training sessions per week. Keep alcohol low. Get consistent sleep. These are not as trendy as blue drops, but they have a much broader safety margin. Supplements are where things get tricky. Methylene blue products sold online vary widely. Some are labeled as laboratory grade, aquarium grade, research use, or pharmaceutical grade. Do not use aquarium products or lab reagents as supplements. They may contain impurities that were never meant for human use. A quality marker would be clear identity testing, third-party testing for heavy metals and contaminants, a certificate of analysis, and transparent concentration in milligrams per milliliter. Even then, you still need medical guidance. There is no official recommended dietary dose because methylene blue is not a nutrient. In online wellness spaces, people often discuss very low oral doses, sometimes in the microgram to low milligram range. In medical and research settings, doses can be very different. That gap is exactly why you should not copy someone else's protocol. Body size, kidney function, liver function, medications, pregnancy status, and G6PD status can all change the risk picture. Timing is also not one size fits all. Some people report stimulation, so taking it late in the day may interfere with sleep. Absorption depends on the product and route. The FDA Clinical Pharmacology Review notes high absolute bioavailability for an aqueous oral formulation, but that does not mean every online product behaves the same way. What enhances absorption? Liquid oral products may absorb more predictably than random capsules, but quality matters more than clever timing. What blocks or complicates use? The bigger issue is not food blocking absorption. It is drug interactions, poor product quality, wrong concentration, and underlying conditions. So who needs methylene blue? Almost nobody needs it in the nutrition sense. There are no deficiency signs like you would see with iron, B12, vitamin D, or magnesium. If you are tired, foggy, cold, anxious, short of breath, or low in motivation, that does not mean you are low in methylene blue. Those symptoms can come from sleep debt, anemia, thyroid problems, depression, medication effects, low calories, low protein, long COVID, diabetes, heart or lung issues, or many other causes. A simple self-assessment is this. Before thinking about methylene blue, ask yourself 4 questions. Am I sleeping 7 to 9 hours most nights? Am I eating enough protein and total calories? Am I moving daily? Have I checked common medical causes of fatigue with a clinician? If the answer is no, start there. Lab tests to discuss with your doctor may include a complete blood count, ferritin and iron studies, B12, folate, thyroid testing, fasting glucose or A1C, liver enzymes, kidney function, and if methylene blue is seriously being considered, G6PD testing. G6PD deficiency is especially important because methylene blue is contraindicated in patients with G6PD deficiency due to the risk of hemolytic anemia, which means red blood cells can break apart faster than your body can replace them. Let's make this practical. If you are a budget eater who feels tired and is tempted by a cheap blue bottle online, your best first move is not methylene blue. Your best first move is building a low-cost energy foundation. Eggs, beans, lentils, Greek yogurt, canned fish, frozen vegetables, oats, potatoes, and daily walking. Spend your money on food, sleep, and basic lab work before experimental supplements. If you are vegan, your first checklist is B12, iron status, iodine, omega-3 intake, protein, and total calories. Vegan diets can be very healthy, but fatigue in vegans is often more likely to involve B12, iron, thyroid-supporting nutrients, or low protein than a need for methylene blue. If you are someone with depression, anxiety, chronic pain, migraines, or sleep problems and you take medications, be extra careful. Methylene blue can interact with serotonergic drugs. The FDA warns that serious or fatal serotonin syndrome may occur when methylene blue is used with drugs that raise serotonin, including SSRIs, SNRIs, MAOIs, some opioids, dextromethorphan, and other medications. Serotonin syndrome can involve agitation, confusion, fever, sweating, fast heart rate, blood pressure swings, tremor, rigidity, diarrhea, seizures, or coma. Now let's look at the evidence without hype. The evidence is strong for one narrow medical use: treating acquired methemoglobinemia in appropriate patients under medical supervision. That is not the same as saying it is proven for everyday energy, anti-aging, depression, dementia, or brain optimization.
For brain function, the evidence is interesting but early. One randomized, double-blind, placebo-controlled human study looked at a single low oral dose of methylene blue and brain activity during attention and memory tasks. It involved 26 healthy adults, so it was small. The researchers found changes in functional MRI activity and some memory-related signals. But this kind of study is a starting point, not a final answer. It does not prove that daily methylene blue improves your life, prevents dementia, or safely boosts cognition long-term. For mitochondrial and neuroprotection research, much of the excitement comes from animal studies, cell studies, and limited human data. Reviews describe methylene blue as a potential mitochondrial targeting compound, but they also emphasize that human evidence is limited.
What do we still not know? We do not know the best long-term dose for healthy people. We do not know the long-term safety of repeated low-dose use in wellness settings. We do not know which people, if any, benefit most. We do not know how many online products contain what they claim. And we do not know whether short-term changes in brain imaging translate into meaningful real-world benefits. The most common side effects people may notice are blue or green urine, blue staining of the mouth or skin, nausea, stomach upset, headache, dizziness, and a stimulated or wired feeling. The prescribing information lists commonly reported adverse reactions in clinical use, such as headache, diarrhea, nausea, low potassium, low magnesium, myoclonus, and seizure-like events, though those data come from medical treatment settings, not wellness microdosing. Less common but more serious risks include serotonin syndrome, allergic reactions, hemolytic anemia, confusion, vision changes, blood pressure changes, and problems with oxygen monitoring. Methylene blue can make pulse oximeters read inaccurately low, which matters in medical settings. It can also interfere with some urine tests because it is a dye.
Special populations need extra caution. If you are pregnant, trying to conceive, or breastfeeding, avoid casual methylene blue use unless a clinician specifically determines it is necessary. The prescribing information warns that methylene blue may cause fetal harm, and breastfeeding is advised to stop during and for up to 8 days after treatment because of potential serious adverse reactions. Older adults should be cautious because they are more likely to take interacting medications and have changes in kidney or liver function. People with kidney or liver impairment need medical supervision because clearance and toxicity risk may differ. People with G6PD deficiency should avoid it unless managed in a specialized medical context because of the risk of severe red blood cell breakdown. Here are the red flags. Stop and seek medical help if you develop confusion, agitation, fever, heavy sweating, shaking, muscle rigidity, severe diarrhea, fast heart rate, chest pain, shortness of breath, fainting, yellowing of the skin or eyes, dark cola-colored urine, severe headache, swelling of the lips or throat, or a rash with breathing trouble.
Now for a quick myth-busting round. Myth 1. Methylene blue is natural because it supports mitochondria. No, your mitochondria are natural. Methylene blue is a synthetic dye with drug-like effects. Myth 2. If a little helps, more works better. Not with this compound. The dose response can flip, and higher exposure can bring more risk. Myth 3. Blue urine means it is detoxing you. No. Blue or green urine usually means you took a blue dye and your body is clearing it. Here is the bottom line. Methylene blue is not a missing nutrient. It is a powerful redox active compound with a real medical role. Interesting early research around mitochondria and brain function, and serious interaction risks. Food will not give you methylene blue, but food, sleep, exercise, and basic medical testing should come before experimenting with it. The biggest safety checkpoint is your medication list, especially anything that affects serotonin, plus G6PD status if use is being considered. Your action today is simple. Write down every medication, supplement, and over-the-counter product you take, including cough medicine and pain medicine, and ask a qualified clinician or pharmacist whether methylene blue would be unsafe with any of them. Have you heard about methylene blue for energy, focus, or longevity? Share your experiences and questions in the comments, and let us know what supplement you would like to learn about next.